At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How Fertility Markers Predict Your Future on Wednesday, November 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
The information provided on Dr. Tom Roselle Live by Dr. Tom Roselle, D.C., interview guests, show co-hosts, or substitute hosts is not intended or implied to be a substitute for professional medical advice, diagnosis, or treatment. It is for general information purposes only. Information from this broadcast should not replace the appropriate consultation and examination process by a licensed physician. Always consult your own physician prior to changing any current medical directive or prescription.
This is Dr. Tom Roselle Live on 105.9 FM WMAL.
Hey everybody, welcome to Dr. Tom Roselle Live right here on WMAL 105.9 in the Washington metropolitan area. We have a great program for you today, another one obviously, and one that you can begin to hang your hat on just a little bit. It's a different program. We're going to be talking about your long-term life as it's predictive based on your hormone balances, which are chemical messengers. But we'll get into that in just a second. I want to remind you that anything that you need to ask about or want to talk to me about, you can simply do it by going to drtomroselle.com. That's drtomroselle.com. And by the way, all of past radio programs in there, you look up at the top and you're going to see live stream and podcasts. The podcasts are all the old shows. So check it out and go to our online store. You're going to find all kinds of things that will protect your health and your environment and so forth. We try to handpick these companies for you. They go direct to the manufacturers. So check it out, see what you find. If you have a question, you let me know. Let's get into the program a little bit. Again, we're talking about hormones as they are essential chemical predictors and messengers because they regulate body function, metabolism, growth, reproduction, mood, and they play a huge, huge role in keeping a natural equilibrium within your body. And by the way, that's going to be the topic of another program that we're going to do at the Roselle Center on November the 19th. And I'll be doing that with Dr. Stephanie Pina, and we're going to be talking about, those aberrations that if you knew something more about, you might be able to say, oh my God, am I really doing this to myself? Well, the short answer is maybe. So we're going to get into that a little bit, but let's start today by talking about this balancing act, if you will, that has to do with your metabolism. It has to do with development of ongoing process. Even though that you're of whatever age you are and you might be above that 40 mark, you still need all the hormones that you were born with. The difference is you need them at different levels, and they have to be much more balanced, if you will, than what they were in your early years. So when we look at hormones like testosterone and estrogens and progesterones and even insulin levels and thyroid hormones and so forth, there's tell signs. And those tell signs are predictive, if you will, of future problems. Like what? Let's say that, and this goes for you guys too, so I want you to remember what I'm talking about. If you have estrogen levels that are in normal platforms, normal levels, normal parameters, but your progesterone level is low, guess what happens? You become a target for tissue destruction. Sometimes we call that what? Cancer. And so you look at something like that and it can say, well, it's not that bad. Well, it is that bad if it's not balanced properly. And don't let anybody tell you, the worst commentary you can hear from any physician is, let's watch it. Let's see what happens. What the hell are they watching? If you have something that's aberrant, it's not normal. Let's figure out what we have to do to make it normal before the symptom shows up and they diagnose it as a pathology. Well, I'm sorry, Mrs. Jones. I'm sorry, Mr. Anderson, but you have this cancer that seems to have already metastasized. It's gone outside the tissue level. Or you have this autoimmune condition called Hashimoto's thyroiditis. Or you have this problem with your heart and this AFib, and it must be POTS. Or you have, and do you hear what I'm saying? Or you're a pre-diabetic pattern, or you're just getting into that pre-diabetic situation. Well, are you going to wait before it's a raging diabetes before you do anything about it? And we're not talking about controlling it um, with medication. We're talking about changing things so it goes back down into normal regulation. So here's the thing that I want you to remember. The body has the capacity, the ability to modulate, to change anything, providing that you put it in a platform that it has what it needs to have to be able to cause that situation to occur. It's called balance. It's called restoration. It's called homeostasis. It's called back to health. So the key functions, if you will, of hormone dysregulation, if you will, are aberrant signaling. The organ systems are not talking to each other the way they're supposed to. You've heard me talk repetitively about HPA axis, hypothalamus pituitary adrenal, but there's also other communication pathways. We've talked about stress and how hormones like cortisol are released into the body and unchallenged, unblunted, can go into situations by first energy going up and then it crashes on the other side and it modulates your immune system. Stress is a killer, absolutely 100%, if it goes on without being checked or modulated. Stress is necessary because it causes your body to go into a defense mode, fight flight mechanism, but uncontrolled, it goes down the tube. How about mood regulation? Did you ever think that your hormones are what controls your mood? And there's things like serotonin and dopamine and GABA that affect mood and emotional well-being. But the question is, why is that? And can we measure it? Absolutely 100% you can measure it. There's a simple urine test that will show the neurotransmitters and how the effect is. So if you know it's there, if you know that there is a consequence to hormonal dysregulation in the early stages, including, as we've said, diabetes and thyroid problems and reproductive dysfunction, symptoms of hormonal imbalance are varied across the board, but we ignore them. We ignore them because we don't want to look at the weight that's around our midsection. We ignore them because, what do we expect for our age? We're tired. We don't have the energy that we used to have. We ignore them because, well, with all the stress around, that's why, my moods are up and down like a yo-yo. We ignore them because there's too much on my mind, and that's why I can't sleep at nighttime. So we look at the wrong conclusion. So hormones are crucial in regulating many different aspects of your life, your growth, your metabolism, from mood to reproduction. But the most important piece is that hormones can be predictive of longevity. They can be predictive of things to come that may not be so fun. They're predictive of things that you can't seem to get a grasp of. Now, if you knew that to be true, wouldn't it be good to find out what it is? And then more importantly than finding out, is there a way of balancing it and getting you back to where you need to be without what? Without using external chemistry, using your own body's optimization. Sometimes a tweak needs to be here. There's some genetic dysregulations that you have to be aware of. But if your hormones are a key indicator of things to come, wouldn't it be good to find out what that is? So when we look at the structural neurological pathways, we look at the chemical, electrical pathways, we look at the decision-making process, the emotional stresses. These are the three things that we have to be able to find quantitative and objective measures to say this is going on. Wouldn't it be nice to know why you get into an insulin resistant pattern that can ultimately give you problems? We know that if insulin maintains itself at a certain level, at an outside aberrant level, that what? You're going to go into diabetes. Straight up. Maybe not in the initial stages. You may go into hypoglycemic pattern, then hyperinsulinemia, and then it gets tired and it crashes. Once you want to know how to cut the risk of dying too early, and why people who were all supposed to live to be what? We're supposed to live until about 130, 140 years of age, and then die gently in our sleep. Wouldn't it be nice to know ahead of time that we're not doing everything that we can to change that and make a difference? I don't know about you, but on an ongoing basis, I try to find out about me. So why don't we think that through a little bit? But here's a more important question. If you knew, if there was a way to predict it, would you want to change it by your own hand? Or do you want somebody else to give you a drug to be able to restore function with the problem of perhaps causing another side effect that you have to use another drug to fix that side effect or cause deterioration, destruction to another system? Think about that for a minute. I don't know about all of you, but for me, if my body can do it and put it together from a neurological platform, from a biochemical platform, from an emotional platform of attractability, something that I think that I'd be really interested in doing. So coming up on November the 19th at the Roselle Center for Healing, we're going to be talking about hormones as a predictive of health. We're going to talk about how they show up. We're going to show you how things can be fixed specifically, how you can take the steps to shift and change, to balance your estrogens, to get the bad guys out, make sure the good guys are the most important, show you the things that you might be doing that may be causing this. I'm going to get into a little bit of it in the program as we go forward right now, and make sure you really understand it, that you really get it, right? So, if you go onto the internet and you look at hormones and endocrine system, hormones and function and so forth, there's very few articles out there unless you really look at as hormones and predictability of things to come. They say, well, this happened, let's fix it. Unfortunately, before they do that, they say, as I said earlier, let's watch it. Let's see what takes place. Are they watching it because they think that something different is going to change? Or are they watching it because they're not sure what to do with it in the first place? Hormones, these secretions can either be too much or too low. And any hormone can be supportive or it can be harmful to the body. They're controlled by the production of other hormones in many cases. So when you look at hormone regulation and growth, the development, the mood, the tissue function, metabolism, sexual function, they all have a common trigger and source. One of those triggers has to do with the pituitary, both the anterior pituitary and the posterior pituitary. Now, where's the pituitary? Pituitary is in your head, it's in your brain. If you take your thumb and you put it back kind of where the soft palate and the hard palate end, going straight up from that is a saddle. It's called the sella turcica. It means saddle. And the pituitary sits in the middle of that. And it downregulates all kinds of triggering mechanisms, something like GH, growth hormone, or ACTH, adrenocortical-stimulating hormone. It triggers things like thyroid-stimulating hormone. It has other metabolic pathways, things like MSH, which affects skin tissue. That pituitary is not working, your skin's going to look like crapola. I think that's a new diagnostic term. Do you like that, crapola? I like it. We'll use it in a couple times. So the posterior pituitary has something called ADH, and that's a fluid regulating hormone. It affects the kidney directly. It has oxytocin that affects breast tissue. Oxytocin is also called the hormone of love. It has prolactin, also affecting the breast tissue, because when you're nursing, you have to downregulate that milk, right? There's things called FSH and LH. These are gonadotrophins. They affect the testicles and they affect the ovaries. Now, with something that important, do you think that if you have a couple of these areas that are not working properly, do you think that perhaps maybe the common source, the pituitary, somehow is not working the way it's supposed to? Common sense would tell you, let's look at the commonality between them and let's see what might be going on. A blow to the head, trauma, injury can cause a disruption in that signaling process. So the good thing is that we can actually measure this stuff. We can do a predictability scan, if you will. So how do you do that? Well, you have to order the right hormone patterns. You have to look at the different pathways that are involved in all of this stuff. So it's not just enough to know that these things are important. We know that they're important. We know that there are different types of hormones. We know that they do different things like growth and repair. That should, we said generally that comes from your pituitary gland, but that's growth hormone. We have all these other little things that signal the ovaries and that signal the uterus. Ladies, did you know LH and FSH are important in ovulation cycle? FSH simply stands for follicle stimulating hormone. Follicle is what? It's the ovarian sac. I'll use it in that terminology, although it's not technically accurate. And inside that sits the ovum, the egg. And until you're done menstruating, that communication from your pituitary to the ovum, to the sac, to the egg has to be ongoing in a normal regulatory pattern. Otherwise, your progesterone levels don't trigger the way they're supposed to. First, the estrogens with the release of the egg. Second, as the degradation of the wrapper around the egg, called the corpus luteum, breaks down, then your progesterone level goes up. And if there's no implantation, it goes down, and then you have your menses. Now, that's a very basic explanation, if you will, of what happens. But what happens if that doesn't work? What happens if that tissue isn't responding properly? What happens if that signaling isn't working? Could there be a potentiation of things that are far greater and more significant? The short answer is yes, absolutely. On the 19th, we're going to look into that, and we're going to show you how to not only predict it, and there are very specific tests and diagnostics that you can use that will predict it, but also how to fix it. What can be done if you're willing to change a few things that will bring you back to where you should be? It's important that you understand how all these things are regulated. The pineal gland sits right behind the pituitary, and it releases a hormone called melatonin. And it has many different targets in the body, believe it or not. It's your biological clock. So if that pineal gland isn't working, or if it's covered, as many will say that it is, with a hard crustacean of calcium oxalate because of our environmental stuff, then it can't work, and it screws up your biological clock. And you may age even faster because of it. There's your piece of longevity. So if that's the case, wouldn't it be great to find out how to fix it, how to regulate it, how to make sure it's working properly? It's not just your sleep cycle, although that can be part of it, but it has other major inputs, including your immunological reactions. How about the pancreas? There's two hormones. It's called insulin and glucagon, and they're a balancing act when it comes to blood sugar regulation. We focus on insulin, we forget about glucagon, and we're going to talk about that. And it has a target. It's called the liver, because the liver then has to release its storage, convert it into glucose, and give you a balancing act of energy. Now, we talked about the ovaries a little bit. The testicles produce testosterone in guys. Ladies, your testosterone comes from your fight-flight system, your adrenal system. Guys, as you get older, your testosterone comes from those two areas. So we begin to look at all the different pieces of triggering and targeting, and we wonder if by measuring hormone, can we measure health and longevity? The short answer is yes, if you know exactly how to put them together. Unfortunately, in the traditional community, they look at specific targets, but they don't look at how they integrate and interrelate to each other. Let's take something very simple, growth hormone. Growth hormone is an important hormone, critically important. And it's produced by our friend, the pituitary gland. And you often see it says HGH, human growth hormone. It's also known as GH, growth hormone. It's a key player, key role in growth, development, body composition, cellular repair, and metabolism. So everybody thinks it's just about the thyroid when it comes to metabolism, or other system that comes to metabolism. We forget that even as we get older, we have to have a certain level of growth hormone, and there's a lot of ways of triggering its production. One is what? Activity, exercise, stress, stressing our muscle patterns, going out and doing things, making sure that we're getting enough high levels of amino acids so we can facilitate repair. What's amino acids? It's called protein. So, I eat protein. What, a handful of nuts occasionally? Maybe. But no, you need a lot of protein. 2 times you need a lot of protein when you're young and you're getting big, and when you're old and you're breaking down. You need to restore that stuff and repair it and make sure that they're very high level and not screw up the absorption because you're ignoring other things, like your digestive enzymes, because you're using protein pump inhibitors that stop the production of your digestive enzymes. There's a way of fixing all that. There's a way of resolving it. Human growth hormone boosts muscle mass, your strength, your ability to perform exercise. And I don't mean playing tennis. I mean just moving around. So while it can help you from disease recovery and injury, low hormone levels, growth hormone levels, may decrease your quality of life. And it dramatically increases your risk of disease because you can't repair anything. And guess what? It's going to make you fat. It's going to put on that fat. It's not necessary that it's just your adrenal system that's doing it with a high cortisol level, but it's making you fat boy. So we have to make sure that we get those up. Fat boy, fat girl, fat person. Yeah, I know. I'm breaking all the rules here, but that's what I do on an ongoing basis. No, look, here's the deal. We want to give you the predictability to show you how to shift and change. Join us on the 19th at the Roselle Center for Healing. Dr. Stephanie Pien and I are going to kind of tandem this, going back and forth. I'm going to show you a lot of things that I can put in your hands to predict what might be going on behind the scenes. But more importantly, it will predict how long you're going to be on the planet on an ongoing basis. You can plug it into a graph and say, if you got this, you got to get this. You may not be here so long, but if you got all these other things, barring an accident, God forbid, you might be in a really good shape. So join us. Go to drtomroselle.com or go to rosellecare.com and schedule for that class. Make it happen today. Remember, my job is to give you data. My job is to provoke you. My job is kind of irritate your back end a little bit. So you'll say, okay, enough's enough. I'm going to do what I'm going to need to do, or I'm going to die. Which one do you want to choose? I don't know about you, but I'm trying to figure out how to be here for another 30 years or so. So let's get it done. We're coming up to the break. Don't forget to join me at drtomroselle.com or all on your social media sites as we go into the live stream right now. Remember, I'm here every week for one reason only. You deserve the information, but more importantly, I love you all. You have a great day. Bye.
Breast cancer is a major health risk to all women. It can silently grow uninterrupted for years. The Thermography Centers of Fairfax reminds all women to conduct monthly and annual breast exams. Consider a thermography scan from the Thermography Centers as an adjunct to your routine breast exams. Digital infrared thermal imaging is safe and non-invasive. For more information and to schedule an appointment, call 703-520-7591 or visit thermographycenters.com.
Neuromuscular dentistry is more than just teeth and gums. Temporomandibular joint disorder can be painful, and only a skilled neuromuscular dentist can diagnose and treat it. If you are in pain and suffering from TMD, call the neuromuscular dentistry experts at Soft Touch Dental Care. Learn more about TMD and how Dr. Michael Chung has successfully treated his patients. Call 703-319-6990 for a complimentary consultation or visit bestinsmile.com. That's 703-319-6990 or visit bestinsmile.com.
At the Roselle Center for Healing, we care about your health and want to help you take your health in a new direction, far from drugs and surgery. Knowledge is the key to optimal wellness and control of your health. We offer free health education on chronic health conditions and natural integrative medicine treatments. Register for free today.
Attend How Fertility Markers Predict Your Future on Wednesday, November 19th at 6 p.m. Space is limited, so register today. Call 703-698-7117 or visit rosellecare.com.
This is Dr. Tom Roselle. After 43 years of practice and over 1 million patient visits, the Roselle Center for Healing knows what works and knows how you can take control of your health and wellness. My team of doctors practice 21st century integrative medicine. Whether you suffer from chronic pain and fatigue, allergies or headaches, we can help. Take charge of your health before it's too late. Make an appointment today. Call 703-698-7117 or visit online at rosellecare.com. That's rosellecare.com.